less is more, be consistent, and find a skin expert or someone whose approach you really believe in and who you trust, and stick with them.
Hi, Rabia.
Hi.
How are you?
I'm well, thank you.
So, Dr. Rabia Malik is an aesthetic doctor and general practitioner. She qualified at GKT at King's College, London in 2004. And her focus is on helping her patients achieve optimum skin health, which is what I really love. She focuses on a holistic approach, specializing in skin peels to deliver healthy, radiant, luminous skin. She also practices at two prestigious London locations, the Harrods Wellness Clinic and Lanserhof at the Arts Club. And she provides a personalized, tailor-made solution, if need be, to individual needs. Tell us a little bit about what you do. And I'll start with asking you, and why you chose not to work with injectables.
Yeah, I suppose I've ended up with a very niche practice because really, I mean, going back, I started to think about skin health and the kind of practice I wanted, about 10 years ago. And at that time, there was only really injectables. But, to me, what I wanted, I was 30 when I started the practice. I'm 41 now. Getting older is a privilege. So, for me, it was about aging well. And, I wanted to be proactive with prevention and maintenance, but I didn't necessarily want to go down the injectable route myself. And so the focus of my practice really ended up being skin tone and texture, because ultimately, in my opinion, and in my experience over the past, number of years, what really makes us look youthful is even skin tone and smooth skin texture. So, having some lines from expression, smile lines, they add to the character of your face. And I personally don't want to take them away. I mean, for sure, I have lines around my eyes because I smile a lot, and you do get those lines from expression, but I wouldn't want to take those away. And I think that you don't want to lose the character in your face. Yeah. So for me, it was all about tone and texture. That's really the focus of my practice. And I started to see that as we get older, a lot of women were feeling like they needed more coverage, so foundation, makeup, but actually that's quite aging. So as we get older, really ideally you want to be using less makeup, less foundation. And the way to feel confident, with your skin and feel happy to be able to wake up in the morning, walk out the door and not put anything on, is really working on skin tone and texture. So that's become the focus of my practice, really. And, by default, I've ended up doing a lot of work with hyperpigmentation, because that's such a common issue that comes up in my practice all the time, particularly with South Asian skin. Pigmentation is a big issue. So, I spend a lot of my time helping people deal with that. And I think that, by default has become a big part of my practice. And skin peels I sort of fell into because I'd done some training in the States, and, doctors in the UK don't really work with medical grade peels so much, but in the US, they're very widely used and they're actually very effective, but very underrated in my opinion.
Right.
So I sort of ended up doing a lot more of that. And, I think it's just really being guided by what people wanted. And, in terms of the injectables, it's not that I'm anti-injectables. It's just that I personally feel that, in today's day, as you said, a lot of people feel, it's the first thing that they do. It's a quick fix. And I think really to get optimum skin health, it's a journey, and you've got to look after the inside. You've got to do all the other bits and pieces, and maybe the injectables are one piece of that, but they're not, what I focus on. But, I have many patients who will have injectables with other doctors and then come and see me for their skin. And that's totally fine. Each to their own. It's just that because I choose not to go down that route myself, I don't feel comfortable, doing that for my patients. And I just think that there are alternatives, and there are different things that you can focus on, treatments to stimulate your own collagen. And that's really the focus of my practice. So, I think each to their own. Everyone has to decide what approach they want. And I think there's so much out there. So I'm just, I'm that doctor for the people who don't want to go down that route. And if they do want something, and I feel the only way they can achieve it is through either some botox or something like that, then I'll refer them to one of my colleagues. So
Right.
I think you have to look at everyone as an individual. The only thing I would say is that unfortunately, I feel people having injectables are now starting to have them much younger.
Mm-hmm.
um, and I think that's a shame, because I personally don't think that's a good thing. And I actually think you can end up aging yourself. So some young girls in their 20s who've had a lot of injectables end up
Oh my
looking the same as, women in their 40s.
God.
So, I think you need to be careful. So less is more, in my
Okay.
opinion.
What are the main skin issues you'd see that people come to you for?
So, I mean, look, as I said, pigmentation's become a really big part of my practice. I think partly because of the type of skin I have, the fact that I help people with, Asian skin, Middle Eastern skin, and pigmentation is such a big issue for those skin types. But I think, everything from acne to acne scarring, psoriasis, eczema, all sorts of skin issues where people are just looking for a slightly more holistic approach. So then maybe they don't want to go down the medication route, or they've tried, courses of medication, they've been to see their doctor, they haven't got the results that they were looking for. And so, they might end up coming to see me because they want to try something a little bit different, or they want an alternative combination approach. Because, what I end up doing is really putting together plans for people that incorporate not only products, but also, supplements and dietary changes, and then treatments as well.
What about acne scars? What do you prescribe for those?
Yeah, so acne scars, I mean, I think the thing with acne scarring is, first of all, there's no point doing anything in terms of treatment until you get on top of the active acne, because otherwise you're just going to be in a cycle. So you'll
Right.
end up, with spots and then marks and scars, and then you'll be in a cycle of treating one and then a new one comes out. So I think the first thing is to get the active acne under control. And then when you've stopped breaking out, if you want to address the scarring, then I think microneedling is a great in-clinic treatment, which gets great results. And I think in terms of topicals to be using at home, some form of vitamin A, so retinol or tretinoin, really helps with skin resurfacing. So helps improve the appearance of scars.
Okay. What do you recommend for aging skin, and what age should people start? How young should they start looking after their skin?
So, aging skin is, again, you can look at it in a number of different ways. There's different things that happen to our faces as we get older, all the way from, changes to the skeleton, so bone changes, muscle changes, changes in fat composition. So, there's lots of different levels of the aging face. But if you're just looking at skin, I would say the number one thing that everyone can do is protect their skin from sun damage. So sunscreen, some form of mineral-based sunscreen, ideally every day, because UVA, which is what contributes to skin aging, comes through the clouds. So even on a cloudy day in London, you're still exposed to low-level UVA. So I think, number one is protect your skin. And then I think that the next thing I would say is, protect your collagen. So our collagen levels start to decrease from the age of about, 25, definitely from 30 onwards. But, early to mid 20s, we start to see a decline in collagen production. So
Right.
maintaining collagen in the skin with the right topical ingredients. So things like vitamin C, which is an antioxidant, but is also a precursor for collagen. So having some form of vitamin C in your skincare in the morning will really help. And then some form of retinol at night, definitely from the age of about 30, 35 onwards, depending on your skin type, I think really helps. And then there are some really interesting new peptides that are coming out which help stimulate collagen. And, I think that there are some really interesting new active ingredients that can contribute to collagen production as well.
Okay. And what about the area around the eyes?
And again, I think sun protection is a big thing. So I think, wearing sunglasses when you're in prolonged sun exposure, if you're out all day, if you're exercising outside, then you do want to protect your skin. So, sunglasses, sunscreen, really important. But then I think, eye creams are controversial because you don't necessarily always need a separate eye cream. It really depends on the formulation. But
Okay.
again, you want to be using the right active ingredients at the right concentrations. And I think, if a product's well formulated and doesn't have any potentially irritating ingredients, then you should be able to use it around the eye area. But obviously, always check first if it's a formulation that you can do that with. But again, some form of vitamin C in the morning, some form of retinol, vitamin A at night will help support the eye area. And there are some really concentrated eye treatments as well that I recommend. There's a few eye products that I really like. There's one called OptiCrystals by Cosmetics. There's another really concentrated one that you can only get from doctors called Eye Doctor. So that's one that we prescribe for people as well. And then I do a lot of eye peels to really help with under eye
Oh,
darkness.
wow. Okay.
Yeah, and they get great results. So I think, they do work. You just, you need to be consistent and you need to have a routine.
So, what is the new exciting scientific discoveries that you've come across recently in skin health?
So, I think what's interesting is, like I said, there's always new and interesting active ingredients. I think, various growth factors, stem cells, peptides, there's always new combinations coming onto the market, which I think are really interesting. I think it takes time to see how they perform because you don't always have the studies, but
Right.
it takes time to kind of see what the outcomes will be when you use them, in clinic or, in products. But there are, really interesting formulation developments. I think that there's some new forms of vitamin A coming onto the market, which are a lot less irritating than previous formulations. So that's really exciting. And I think there's also really interesting online skin analysis tools, augmented reality, things where you take a selfie and, there'll be some sort of computer program that will scan and then give you advice based on
Oh,
the outcomes.
wow.
So yeah, I think there's a lot of that sort of thing that's going to come onto the market. And I think there's a lot of technological advancement in terms of at-home devices as
Mhm,
well.
mhm.
Because, as I mentioned, I think there's a lot more demand for tools, devices,
Right.
things people can use effectively at home. So I think we're going to be seeing a lot more of that as well.
When you're talking about at-home devices, so anything that's really state of the art, which that you recommend in terms of a device?
There's nothing that so new per se, but I think that there are forms now that bring some of the technologies into people's homes more easily. So, LED light, there's
Yes.
now a lot of masks that are much more accessible. They used to be really only available in clinic and they
Mhm.
were very expensive and not necessarily so easy to use, but I think now there are great at home options. I think that there's even at home micro needling devices.
And tell us, given that, we want to empower everyone with health and wellness, what is your last advice?
So, I think less is more. Be consistent and find a skin expert or someone whose approach you really believe in and who you trust and stick with them. So people get really confused and they kind of, come across one opinion here and then something else over there. They don't know who to listen to. And so I always say, just find somebody whose approach really resonates with you. Because, at the end of the day, we're all different. We all have slightly different approaches, and we all have a slightly different focus. So I think you just need to find someone who you connect with, and then really, stick to their regime or to what they recommend, because then you'll really see results.
The Gua Sha, are they any good?
Yeah. So, I mean, Gua Sha rollers, whether they're jade rollers. So, I would say all of these tools help with, facial massage, which ultimately helps improve circulation. So, when you're oxygenating the tissue, when you're doing facial massage, you're basically improving circulation, and that's a good thing. So, I think that's very positive. I think all these tools they help, with doing that. But you can use your fingers. You can use very basic tools. You don't necessarily need to use something branded. But
Hmm.
yes, I do think these tools are good. I think again, you just need to be consistent like all these things. I think there's no point buying it if you're going to use it once and then it's going to go
Yeah,
on your bathroom shelf for 6 months,
yeah.
then don't bother. But if you can make it part of your routine, then I think you'll see the benefit and then it's worth it.
Do laser facials work for everyone?
I don't think they work for everyone. I think it really depends on your skin type. I think they can be good for some people, but you really need to know what laser is being used and the settings that it's being used at, because not all lasers and not all settings are suitable for all skin types. So I think, you really need to go somewhere where you trust that they know what they're doing and they also understand your skin type. Because laser for some skin types, even like my skin, so South Asian skin, I've had pigmentation from laser,
Oh,
as a
wow.
response to that, and
Yeah.
that's going to someone who really should know exactly what they're doing, and you can still end up with issues because our skin is just prone to putting down melanin. So I
Mm.
think you need to be really careful, particularly if you have Middle Eastern or Asian skin.
What would you suggest for pigmentation?
First of all, for many people, pigmentation is a lifelong chronic issue. So there's no cure. It's about managing it. And the way to manage it is to limit your exposure to the sun, which is usually the main trigger, and also to look at the hormonal levels because changes in hormone balance, again, can be a very big contributing factor. So for a lot of people, they have pigmentation issues around pregnancy or around menopause
Right.
because that combination of the change in internal hormone levels as well as exposure to UV is like a recipe for pigmentation.
Ah, okay.
So people really need to understand what the contributing factors are and then manage their exposure to those. And then you need to support your internal health by increasing your antioxidant intake. So, you then need to have the right products, the right supplements, and the right treatments. And then it's a chronic, it's a maintenance regime. So you never kind of think of pigmentation as, okay, that's it, I'm doing a
Mhm.
treatment. Usually what happens is you can get it to go away, but the minute you're out in the sun or by the time summer arrives again, often what happens is it comes back. So you're constantly managing it. So, in terms of like my top takeaways, I would say vitamin C is like the
Mhm.
easiest and probably one of the most effective things to incorporate. So, liposomal vitamin C as a supplement, so an oral supplement,
Mhm.
and then some form of vitamin C topically, so
Mhm.
on your skin. And then I work with peels to really help with pigmentation management, and we get great results. So, finding someone who really understands pigmentation and can do very customized peels, because again, you don't want to be too aggressive because then you can cause more pigmentation. So, it's getting the balance right. But in terms of the easy things, I would say is start taking a liposomal vitamin C supplement and start using vitamin C on your skin. Start with that.
Okay.
And I would avoid hydroquinone because hydroquinone often leads to rebound pigmentation. And what that means is that initially you'll get some improvement, but when you stop using it, often the pigmentation all comes back.
Okay.
So it's not a long-term solution in my experience.
What about eye bags?
I mean, the definitive solution for eye bags is surgical. I mean, I wouldn't sort of say to you that any of the sort of non-invasive treatments are really going to work because what an eye bag is the movement of a fat pad. So it's an anatomical, change in the face. So that's the ultimate solution. But There are some non-invasive things that can help. So, for example, the plexer treatment that I mentioned
Mhm.
can help. Some types of laser can help. I find that the eye peels that I do work more for discoloration. They're not really going to help with eye bags, but they can certainly help with the improving the appearance of the under eye area. The only real definitive solution is surgical.
Is Obaji good?
So Abaji, look, it's a medical grade skincare range
Mhm.
prescribed by doctors, developed by a doctor called Obaji in the States about 30 years ago. And it was a great medical skincare line, particularly when it launched. It was probably the first of its kind. I've worked with it over the years, and I think it had its place. My personal opinion is that technology has moved on. We now have access to newer formulations, newer active ingredients, and in my opinion, Abaji is a very aggressive range, which I personally, I think that there are other less aggressive approaches which are actually just as effective in the long term. So I am personally not a huge fan of it because it's not the route that I, sort of go down. And I find now, because of the way, people's lifestyles are, people don't want a lot of downtime. So something like Abaji is very aggressive. You'll get a lot of skin peeling, a lot of redness, and a lot of people, just can't tolerate that. It doesn't work for them. So I prefer things that are, maybe slightly more longer term. So they might take a bit longer to get the results, but they're going to be less aggressive and less downtime along the way.
How can you make the skin glow?
Look, glowing skin is the ultimate goal, isn't it? So it's what we all want. But there's I think of it in two ways. You can get a very quick superficial glow by exfoliating skin. I think there's some great enzyme-based masks. I like one called Pure Enzymes by Cosmetics. It's on my website. I think that's a good, very gentle but effective exfoliant. And I think that kickstarts that whole skin renewal process, which contributes to glowing skin. At the end of the day, you need to get rid of the dead skin cells on the surface of the skin for skin to glow. But
Mhm.
the ultimate glow is really, from the inside. So you need to be eating well, you need to be sleeping well, you need to be not drinking too much alcohol, but drinking plenty of water. You need to be hydrated. And if you're doing all of those things, then your skin really is going to glow, from the inside out. And I think that that's the ultimate glow is really when you are addressing all these different aspects. But I think the exfoliators are a good quick fix.
Okay, that's lovely. Thank you so much and take
Oh,
care.
it's a pleasure. Thank you.
Thank you for listening to this chat. If you enjoyed it, please subscribe to this page. Please subscribe to our podcast on Apple and Spotify, Wellness Curated, and follow us on Instagram, Wellness Curated, the number one. Thank you.